Well, the World Health Organization is giving an update on the latest developments in the fight against COVID-19. Dr. Tedros is, in fact, already up speaking, the Director General of the WHO. Let's take you live there.
To female health workers. We're particularly concerned about the health and well-being of women and girls. I call on the international community and all actors to prioritize their access to all health services and to safeguard their futures. We cannot backslide on 2 decades of progress. Our staff remain in the country and committed to delivering health services to the most vulnerable. Yesterday, WHO dispatched trauma kits and other medical supplies to help health workers responding to the increases in injuries they are seeing. I also spoke to the acting health minister, Dr. Wahid Majruh. He is in Kabul working to avoid disruptions and keep essential health services moving. And I thanked him for his commitment to stay in the country to help the needy. And I assured him that WHO and staff will continue to support the country. With World Humanitarian Day tomorrow, I can honestly say that I have never seen so many emergencies happening simultaneously. This moment in history is one of extreme fragility. Member states tempted to slip into isolation would do better engaging with one another. The humanitarian system is being pushed to its absolute limit and beyond by the climate crisis, natural disasters, conflict, and the pandemic. As urban areas expand, humans and animals are living in ever closer proximity, and we're seeing increasing numbers of spillover events. 2 weeks ago, we notified the world of a case of Marburg in Guinea. This week, a new case of Ebola was identified in Côte d'Ivoire, marking the 3rd outbreak of Ebola this year. The patient confirmed with the Ebola virus had traveled to Abidjan by road from Guinea, putting both countries on an emergency footing. Thousands of doses of Ebola vaccines were sent from Guinea to Côte d'Ivoire, and ring vaccination of high-risk contacts has started. We will continue to do our best. And WHO deployed experts to join their country-based report counterparts to support the Ministry of Health to ramp up infection prevention and control, diagnostics, contact tracing, treatment, community mobilization, and cross-border surveillance. Guinea also deployed ring vaccination experts and provided, along with partners, shared monoclonal antibody treatments to Côte d'Ivoire. Solidarity and leadership of this sort is the best weapon against a dangerous virus that doesn't respect borders. Effective early treatment and supportive care can significantly improve the chances of surviving Ebola, and ring vaccination can help stop an outbreak in its tracks. This level of solidarity would be useful in tackling the COVID-19 pandemic. Last year, around this time, WHO warned about vaccine nationalism and how it would only prolong the pandemic. For the past year, we have called on countries to share doses and scale up manufacturing equitably. Some countries are now sharing doses. The largest is the US, which we appreciate and encourage others to follow by sharing more doses faster. Delta continues to outpace our collective response. And within each country, hotspots of hospitalization and death are where there are low levels of vaccination and limited public health measures. We do have solutions to the challenges of Delta and current variants. That's why the Strategic Preparedness and Response Plan urgently needs an additional $1 billion. And in addition, under a multi-agency funding ask, the ACT Accelerator launched a $7.7 billion appeal. The aim is to rapidly scale up testing, oxygen supplies, treatments, vaccines, protective equipment for health workers, and enhance research and development into the next generation of health tools. At present, just 10 countries have administered 75% of all vaccine supply, and low-income countries have vaccinated barely 2% of their people. I called for a temporary moratorium on boosters to help shift supply to those countries that have not even been able to vaccinate their health workers and at-risk communities and are now experiencing major spikes. Last week, WHO brought together 2,000 experts from all around the world and debated the available data on boosters. What is clear is that it's critical to get first shots into arms and protect the most vulnerable before boosters are rolled out. The divide between the haves and have-nots will only grow larger if manufacturers and leaders prioritize booster shots over supply to low and middle-income countries. The virus is evolving, and it's not in the best interests of leaders just to focus on narrow nationalistic goals when we live in an interconnected world and the virus is mutating quickly. In fact, strong national leadership would be to fully commit to vaccine equity and global solidarity, which would save lives and slow variants down. In this context, I was stunned by the news that J&J vaccines, fill and finished in South Africa, are leaving the continent and going to Europe, where virtually all adults have been offered vaccines at this point. We urge J&J to urgently prioritize distribution of their vaccines to Africa before considering supplies to rich countries that already have sufficient access. Furthermore, following WHO recommendations regarding the use of IL-6 blockers that showed a reduction in death amongst patients hospitalized with severe COVID-19, our current challenge is again limited supply. We call for equitable allocation and for Roche, the drug maker, to share technology and know-how. To overcome these fragile times, we must do better at sharing resources and health tools. Our mutual resilience is only as strong as our weakest bond. Vaccine injustice is a shame on all humanity. And if we don't tackle it together, we will prolong the acute stage of this pandemic for years, when it could be over in a matter of months. When G20 health ministers meet on the 5th and 6th of September in Rome, I will call on them to consider the fragility of this historic moment and make a clear, defining commitment to solidarity. From identifying the origins to sharing vaccines fairly, to building resilient societies that are prepared for climatic shocks and future disease outbreaks. This is our great calling, and I urge leaders to come together and match it. Whether it's pandemic response, new disease outbreaks of Marburg or Ebola, civil unrest, an earthquake in Haiti, or responding to the effects of the climate crisis, WHO will always be there working to save lives, strengthen science, find solutions, and build solidarity. Tariq, back to you.
Thank you, Dr. Tedros. We will now open the floor to questions. We will remind journalists to ask only one question so we can get as many as possible. As I have said, journalists may ask questions in 6 UN languages, and Portuguese. With this, we will start with Reuters, Stephanie Nebehay. Stephanie?
Thanks very much. Hello, everybody. Dr. Tedros, you referred to the Delta variant as outpacing the response. I wonder if someone could comment, please, on how, in some cases, the Delta variant is breaking through and infecting people who have even been double vaccinated. I wondered if somebody could talk about what sort of patient profile seems to be most vulnerable to, contracting the disease despite having been double vaccinated. Thank you.
So, sorry, I was wondering if Anne wanted to take that because she's talking about vaccination, but since I have the floor, can I just take a moment about the Delta variant itself? So, Stephanie, you ask a very important question, but I want to put it into context because the Delta variant, of course, is the latest variant of concern that we are tracking around the world. It definitely has increased transmissibility. We're really working with scientists around the world to understand why. But I want to emphasize that it's the circulation of the Delta variant in the context of many other factors that is really driving the transmission around the world. As the Director General said in his speech, many of the places around the world where Delta is surging, even in countries at a national level that have high levels of vaccination coverage, the virus, the Delta variant itself, is really circulating in areas of low level of vaccine coverage, and in the context of very limited and inconsistent use of public health and social measures. And when you have people that are mixing, coming together, the Delta variant circulating, low levels of vaccine coverage, and inappropriate or non-existent use of public health measures like masks, like physical distancing, avoiding crowded spaces, good ventilation, spending more time indoors together in packed areas where the virus will thrive as opposed to outdoors. This is the situation where the virus is thriving. So the Delta variant itself is more dangerous because it is more transmissible, and that will lead to more cases, more hospitalizations, more people resulting in severe disease, and ultimately more people dying. It's in the context of those other factors. And I mention this because we have tools. And so maybe Anne will come in and speak specifically about vaccination, but we do know that the vaccines work against severe disease and death. So when it is your turn, please get vaccinated and receive the full course of those doses, because there are people around the world that are begging for those doses. And so we really need to be using those most appropriately around the world to bring this virus under control.
Thank you. Dr. Swaminathan, would you like to add something?
Thank you, Tariq and Stephanie. I think Maria has really answered the question very well. When the clinical trials for many of these vaccines that are currently in use were done, Delta was not the major variant that was circulating in the world. And in any case, the vaccines that were studied were looking at, symptomatic disease and particularly severe disease as endpoints. Because Delta is so much more transmissible, we do see these breakthrough infections occurring in people who've received both vaccines. But if you look at the outcomes that we're really concerned about, which is severe disease, hospitalization, and death, those are clearly being prevented by the vaccines, and that's true for Delta as well. So as Maria just said, the increasing cases that we're seeing in countries are mainly among unvaccinated. They are the ones landing up in the hospital. There are studies now looking at what happens over a period of time because there are so many moving parts. We have the variants that are changing. There are different vaccines in use around the world. And of course, each vaccine could have a slightly different immune response. There are all the other factors which people are experiencing through social mixing, which is encouraging the transmission of virus. So I think the bottom line is that the vaccines that are currently being used, that are approved, are still protecting, to the tune of about 90% or more against the severe disease outcomes, while breakthrough infections, mostly mild, are occurring. And this is why masking is so important. And there's been some recent modeling done to show that even in countries with high vaccination coverage, everyone wearing a mask will help drive down community transmission much faster. So I think for the time being, we should go with encouraging as much vaccination as possible, which can only happen if countries share the doses with those who don't have enough, as well as the personal protective measures and all the other public health measures that we know work. Thanks. Maybe Anne wants to add any data to this.
Thank you, Soumya. I understand Anne is fine with these answers. So let's go to next question. We have Gunilla van Hol from Swedish newspaper. Gunilla?
Yes, hello, can you hear me?
Yes.
Good. I have a question also connected to the vaccine booster dose. What data do you have today, not only from vaccine makers, of the decreased protection after 2 doses, especially when it concerns the Delta variant? And isn't it understandable at the same time that more and more rich countries now they're preparing to have booster strategies? Isn't this, after all, understandable? They want to protect their own populations. Thanks.
Thank you. Dr. Swaminathan or Dr. Hombach, who would like to take this one?
I think Dr. Hombach can come in because the SAGE has recently put out some a note, an update on their position on the need for boosters and also the need for more research on boosters, because we believe clearly that the data today does not indicate that boosters are needed. And we need to know which groups, at what period after the vaccination, and which particular vaccines people have received in their primary course. But Joachim can elaborate on the SAGE guidance in this regard.
Yes, thank you. So we have indeed 10 days ago put out a little note that basically summarizes the state of knowledge and also the data that will be needed in order to move ahead. And I think what is important in relation to your question is actually that there may be two things that kind of intertwines, and it's important to keep this separated. No vaccine is 100% effective. And if you have high vaccination coverage, you will, of course, always have cases, breakthrough infections, or what we also call primary failures, where the vaccine actually doesn't work. That is normal, that occurs. And the proportion to which this happens may differ from vaccine to vaccine, definitively. And then comes the other topic, which is the issue of waning protection. And that basically means a decline over time. Now, the first thing is that we actually have pretty little data on this. And so we are certainly gathering more data. There are some pieces of information that have come out, and I think which have been very widely discussed also already in the press, which indeed show or suggest some decline in protective efficacy in relation, however, and that's the important point, and Soumya said it before, in relation to mild disease and infection. We virtually have not seen a decline in relation to the really most important objective that we have, namely the prevention of severe disease. So that is the status where we are. The analysis is extremely complicated because obviously we have not many studies, we have different vaccine, we have the emergence of variants, and we have different population groups. But what is clear is that we do not have sufficient information, and the data are not suggestive that at that point in time we need booster vaccinations. That's the current situation, and that is the position that we have put out.
Dr. Ryan would like to add something. Dr. Ryan.
Yeah, great. Thanks, Tarek. I just want to add, Joachim and Soumya and others have laid this out. I think, though, regardless of what ultimately the science comes to an agreement regarding the length of protection or the increased benefit from marginal increase in benefits from having booster doses, the reality is right now, today, if we think about this in terms of an analogy, we're planning to hand out extra life jackets to people who already have life jackets, while we're leaving other people to drown without a single life jacket. That's the reality. Science is not certain on this. There are clearly more data to collect. But the fundamental ethical reality is we're handing out second life jackets while leaving millions and millions of people without anything to protect them.
Thank you, Dr. Ryan. Let me just see if anyone else would like to add something. Dr. Henao-Restrepo, would you like to add something, or Dr. Lindström?
Thank you very much, Tariq. Just to mention that we have a consultation with 1,900 participants, all the global experts on COVID vaccines. Our consultation last Friday, August 13, included scientists, developers of vaccines, policymakers, regulators, and the public policymakers at large. During this consultation, what we try to do is to provide a framework for the discussion, as Dr. Ryan was proposing and is saying about what is the science behind booster doses, so that if we make a decision, we use the science to inform our decisions. As noted, we have still randomized data that are lacking information on the variant, on the Delta variant. The reductions in vaccine neutralization titers cannot be properly linked to clinical outcomes, and what is the clinical relevance of these observed and reported reductions is not yet known. We have observational studies, most of them conducted in countries with high coverage as noted, and therefore there is complexity in the interpretation of this data. And overall, the clinical evidence on the need of booster doses is sparse. We are going to continue to work to implement a coordinated research agenda that will allow all of us working together to bring the world closer to ending the pandemic for everybody. Thank you.
Many thanks, Dr. Henao-Restrepo. We will go to the next question. We have Micheline Duclef from NPR. Micheline. Can you unmute yourself, Micheline, please?
Yes. Oh, hello. Hi.
Yes. Yes, please. Yes.
I just wanted to get a comment or a response to the fact that the Biden administration is supposed to recommend boosters today at a press briefing. I'm wondering if we've already discussed it a little bit, but I'm wondering if you could just respond directly to the fact that it looks like they're going to be recommending boosters for all Americans over age 12 after 8 months vaccination. Any other response to that?
I think we just covered that question. I don't know if anyone want to add anything from.
Actually, maybe I can say something more specific. I think that there is this question. There's this idea in America that it's a false choice, that there's enough vaccine supply to both give Americans boosters and, cover the rest of the world. Is that the case? Is next year will there be 14 billion doses available? Is supply not an issue?
Dr.
Hi, Micheline. Thank you for the question. If supply were not an issue, we wouldn't have the problem that we do in COVAX right now. In terms of enough supply to reach those populations that are at highest risk around the world, the healthcare workers, the older populations, the comorbids, yes, there is enough vaccine. As of today, 4.7 billion doses of vaccine have been administered around the world. That will soon pass the 5 billion mark. So yes, there is enough vaccine around the world. However, it's not going to the right places in the right order to save as many lives, prevent as much severe disease as possible. And until that happens, it's difficult to understand the position that there is enough vaccine going to the places that need it. Because if you look at COVAX today, we have shipped 200 million doses of vaccines. The goal is double, triple, quadruple that, and certainly by the end of this year to have reached over 2 billion doses. There's one reason we cannot do that: supply. We can move the vaccine out, we can ship the vaccine out, but we can't ship vaccine that isn't in COVAX. So the global supply is definitely a problem. We are still supply constrained. And so and also you remember a little bit to the question that Gunilla asked earlier. as countries start making choices about how they vaccinate, other countries will follow those choices. And the problem that we end up with is we lose that solidarity of working as a global community, which is absolutely crucial to getting out of a pandemic. We don't know if booster doses are going to make a big difference in terms of severe disease and death in the near term. You've just heard the scientists speak to the evidence in that regard. We do know that vaccinating many more people who are unvaccinated will save lives. So it's a fairly straightforward proposition.
Thank you. Dr. Swaminathan, would you like to add?
Just very brief to add to what Bruce said, just some numbers out there. I think if all high-income countries decide that they would like to give booster doses to their above 50 populations, we're looking at, again, close to 1 billion doses that are going to be needed for those boosters. And, many countries are already beginning, even in 2021. And once you begin a program like that, it's very hard to step back. So the right thing to do right now on the science side is to wait for the science to tell us when boosters, which groups of people, and which vaccines need boosters. And the second argument is a moral and ethical argument of giving people third doses when they're already well protected, and while the rest of the world is waiting for their primary immunization. Now, I want to make a distinction here between an earlier announcement from the FDA and the CDC about giving a third dose in the primary vaccination series to people who are immunocompromised, whose immune systems don't work well, because there's some evidence that a third dose actually helps to bring those antibody levels up in these people because their immune system. Now, that's a small number of people, and they should be protected because they are at high risk. But here we're talking about everyone in high-income countries getting a booster. This is an impossible situation. And I'm afraid that this will only lead to more variants, to more escape variants, and perhaps we're heading into even more dire situations. But I think let's focus on the science and make decisions.
All right, a lot of talk around the variants, vaccinations, and certainly focusing on what the science has for us. That is the WHO briefing for us, the World Health Organization, giving an update on the latest developments in the fight against COVID-19. All right, let's take a short break. I'll be back with you at the top of the hour with your headlines. Do stay with us.